Hello and welcome to Specialist Area Surgery, topic cholecystitis. Today we'll start off with a few questions. Question 1. Cholecystitis can present with a positive Murphy's sign. True or false? The answer is true. We'll be talking later on about what is a Murphy's sign. Question 2. Surgical intervention is usually the first approach required. True. Although you manage the symptoms conservatively, the cure is surgical. Question 3. Which investigation carries increased risk of pancreatitis? The answer is ERCP. It carries an increased risk of pancreatitis. We'll be covering a few questions. What is cholecystitis? The symptoms, investigations and differential diagnosis, and management from a surgical viewpoint. Cholecystitis. This is the acute state of a gallstone or tumor impacting in the neck of the gallbladder, which may cause continuous epigastric or right upper quadrant pain, and it can be referred to the right shoulder as it may irritate the diaphragm. The main difference from biliary colic is the inflammatory component, peritonism, fever, and high white cell count. If the stone moves to the common bile duct, jaundice is common. Some of the key differences. Cholelithiasis means gallstones in the gallbladder. Cholelithiasis, it stones in the common bile duct. And cholecystitis is inflammation of the gallbladder. Some of the symptoms and signs. Nausea and vomiting, fat intolerance or steatorrhea, dark urine and pale stools being steatorrhea, jaundice pruritus, Murphy's sign. Deep breath onto a hand pressed into the right upper quadrant elicits pain and stops respiration, which could indicate cholecystitis. Tachycardia, diaphoresis, and sepsis signs. Some of the investigations that you might want to carry out are bloods, FBC, direct bilirubin, LFTs, coagulation, amylase, and lipase. FBCs, the white blood cells may be raised for cholecystitis, and changes in RBCs may indicate a hemolytic anemia. Direct bilirubin indicates level of bilirubin in the blood. LFTs may display any of pre-, inter-, post-hepatic patterns of jaundice. And coagulation, important indicator of liver dysfunction, and can be significant if intervention is required. Amylase and lipase are elevated levels to rule out acute pancreatitis. Some of the imagings that you might want to do are ultrasound. It's a method of choice for diagnosing suspected gallstones. CT-MRI may be used to image the tract prior to surgery. And ERCP for imaging of the bile ducts with radiocontrast, and it carries an increased risk of pancreatitis. Some of the differential diagnoses are cholecystitis, biliary colic, or pancreatitis. For the surgical intervention, medical, you would want to give them IV fluids. NSAIDs, start with this and maybe work up the pain ladder. Antiemetics, antibiotics, and extracorporeal shockwave therapy, or oral dissolution therapy, may be used if patient doesn't want surgery or is in incredibly high risk. For the surgical side, laparoscopic cholecystectomy, this is the definitive surgical intervention and should be performed in symptomatic patients. Bile duct stone removal should be performed either at the time of ERCP or with exploration during laparoscopic removal of the gallbladder. Let's end with a few questions. Cholecystitis can present with a positive Murphy's sign. True or false? The answer is true. Question 2. Surgical intervention is usually the first approach required. True or false? The answer is true. And last question, which investigation carries increased risk of pancreatitis? The answer is ERCP. Thank you very much for listening to this presentation.